Imagine two different roads, each leading to a different destination. That's what we have with type 1 and type 2 diabetes. Now you might be wondering, aren't they just the same condition with a different label? But that's where you'd be mistaken. Just like two roads diverging in a yellow wood, these two types of diabetes may share a name, but they take you on very different journeys. Type 1 and type 2 diabetes are as distinct as the sunrise and sunset. They're both times of day, sure, but they paint the sky with different colors, bring different temperatures, and set a different mood. In a similar vein, type 1 and type 2 diabetes, while both affecting the body's ability to use insulin, have different causes, symptoms, and treatment strategies. Stay tuned to find out what makes these two roads so very different. First, let's navigate down the path of type 1 diabetes. This journey begins early, often in childhood, adolescence, or young adulthood. Unlike a hike where you may stray from the path, with type 1 diabetes, the body's own immune system veers off course. Rather than fighting off harmful invaders, it attacks the body's insulin-producing cells in the pancreas. The symptoms may seem like a mild disturbance at first: increased thirst, frequent urination, constant hunger, unexplained weight loss, and fatigue. But these are warning signs of a body struggling to regulate its blood sugar without insulin. When it comes to treatment, managing type 1 diabetes is a lifelong commitment. It involves balancing insulin doses with eating and other activities throughout the day and night. It's a challenging path to tread, but with proper management and a proactive approach, it's entirely possible to lead a healthy and fulfilling life. Now that we've explored type 1 diabetes, it's time to venture down the path of type 2. Welcome to the journey down the road of type 2 diabetes. This path often begins later in life, more frequently appearing in adults. Unlike type 1, it's tied closely to lifestyle factors like diet, exercise, and weight. It's not an autoimmune response, but rather a condition where the body doesn't use insulin properly. It's a more gradual process, often preventable and manageable through lifestyle changes. As we've seen, these two paths are clearly different, but they're both important to understand. We've journeyed down two different roads today, learning about the unique aspects of type 1 and type 2 diabetes. To recap, type 1 is an autoimmune condition where the body doesn't produce insulin, while type 2 is a metabolic disorder where the body doesn't use insulin properly. These distinctions aren't just medical jargon, they are vital for better health awareness. Remember, knowledge is power. Hit the subscribe button and the notification bell for more health and wellness tips. Don't forget to check the pinned comment for more resources on living a diabetes-free life.